Dr. Campano, can laser treatments help with sun damage to the face?
Sure, there's different types of therapy. One would be the standard laser, and again, you want to look at the patient's skin type to determine the type of laser. Based on that, different people have different problems with their skin. Some people have hyperpigmentation, which are dark spots, brown spots. We call them age spots. And there's a certain laser that I use it's called selective photothermolysis, which is a fancy way of saying it sees the brown and it targets it, and so it makes that melt away and it lightens it up, because the sun will trigger your skin to protect itself, and it will trigger something called a melanosome to make pigment, and sometimes that can be in different irregular areas, and we see them as some people have freckling, and then as we age we have age spots. So the laser can be used to target that, find the pigment, and then attack it, so it will lighten things up.
About how many treatments are needed?
For that, usually just one treatment is needed. Some people might need a second or third. However, I've had patients who said, oh, it went away, but it came back, but they've been out golfing without any hats or sunscreen. They weren't protecting themselves, because the sun will really try to just trigger that reaction again, so you want to protect yourself. Another device that we can use is something called intense pulse light. Whereas laser is one specific frequency of light, intense pulse light actually has a whole spectrum. So it targets both the brown and the red, and also sometimes the veins. So it in general helps a lot of different problems, such as rosacea, which is a redness of the face, sun damage, brown spots. It's kind of the most bang for your buck kind of treatment, and it's faster treatment. Usually I do 3 treatments for the IPL, about 2 weeks apart.